Good afternoon. Our presentation today is going to be an interdisciplinary solution-based approach for mental health and health disparities. Meet the dream team. My name is Timothy Johnson II. I'm a rising senior attending Hampton University, majoring in biochemistry with a minor in leadership studies from Grand Blanc, Michigan.
Good afternoon. I am Sydney Newsome, a rising second-year pharmacy student at Florida A&M University from Jacksonville, Florida.
Good afternoon. My name is Daniel Searcy. I am a rising junior at North Carolina A&T State University. I'm majoring in computer science, and I'm from Shawnee, Kansas.
Good afternoon. My name is Minia Williams. I am a rising senior psychology major attending Spelman College from Detroit, Michigan. Martin Luther King Jr. said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane."
In this presentation, we will talk about the three influences on mental health in minorities, the impact of COVID-19, and our interdisciplinary solution. So I will now pass it on to my colleague Timothy to start with socioeconomic influences.
Thank you, Sydney. As many of you may know, your socioeconomic status bears weight on many factors concerning your life, from where you live and go to school to what options and access to healthy food you have. As you can see, this is a map of the United States based on median household income in 2020. The pale green areas are going to be your lower income states, as the dark green areas are going to be your higher income states. In higher income areas, there's more money to afford treatment versus lower income areas where there's less money to afford treatment. Lower income areas are mainly minority populated, as many of us know. Paying attention to the red circle, you can see Missouri and how it compares to its counterparts nearby. The major key here is, with lack of money to afford resources, minorities go untreated and undiagnosed, not because they don't need the help or that they don't deserve it, but because it's not a priority and it's not something that you visibly see in the community. What's your zip code? Similar to household income, zip code also plays a role in minorities being able to afford adequate care for their issues concerning mental health. Some factors associated with zip code are life expectancy and job offerings. The blue map is a map of Missouri by county, and it shows the percents of Missouri population living in poverty by county in 2019. The dark blue areas have greater than 25% population living in poverty, whereas the light blue areas have less than 10% of the population living in poverty. Please draw your attention to the bottommost circle. It encompasses the Boot Hill. Now compare it to the top circle that encompasses metropolitan Missouri. You'll see that the poverty rates in these two areas are vastly different. Since 2007, poverty rates have been increasing across the state of Missouri from 13% to 16.2%. And in most recent years, a decline has started to appear in this trend, according to the Missouri Community Action Network. But what does this mean? If it's only one psychological institution in a low-income area, because of supply and demand, they can charge whatever they please, versus if there are multiple institutions in a high-income area, the institution is going to be very price conscious to keep their business going and alive. I'm now going to pass it over to my colleague, Minia.
Let's look at environmental influences on mental health in minority communities. We will be interrogating environmental racism and injustice. Minorities are disproportionately affected by environmental hazards. Race is a better predictor of dangerous exposure to air pollution than income. Exposure increases the risk of mental disability and mental health, such as ADHD. Research indicates children in minority communities who have been exposed to environmental issues are twice as likely to develop schizophrenia. Next. Another aspect that affects mental health in minority and rural communities are food insecurities. The gut is the second brain, as explained by Truman Medical Center's retired chair of anesthesiology, Dr. Chow, on maintaining a balanced and healthy lifestyle through dieting. Lack of access to nutritious foods can lead to the development of mental illness within minority and rural communities. Research indicates that children who eat fewer fruits and vegetables are more likely to develop ADHD. Next, please. Both neighborhood safety concerns and fair standards of living contribute to a 55% increase in anxiety and depression within minority children.
Also worth mentioning that exercise is essential for healthy brain development and functioning. Safety concerns could impact the overall willingness to go for walks and jogs. Now passing it on to my colleague Daniel.
Thank you. I will now be speaking to you about the lack of access to psychological services. Next, please. Rural communities are lacking psychological services in 4 areas: resources, education, transportation, and quality of care. Resources for these services would be the cost, the medication, and the amount of mental health professionals. These resources also impact quality of care. Education would be the amount of awareness a community has for the resources that are provided. And when it comes to transportation, many people are not able to travel the distances needed to get to these services. Next, please. Diving deeper into these 4 areas, for resources, areas with low government funding do not have enough resources for these services. According to the U.S. National Library of Medicine, an estimated 49% of Missouri's population lives in a mental health underserved area, compared with 29% nationally. The Western Interstate Commission for Higher Education states that the most significant challenge preventing rural Americans from receiving care is the lack of mental health professionals providing mental health services in those areas. In education, nationalcouncil.org states that while most Americans have heard of telehealth as an option, only 7% have reported using it. And while most Americans seek treatment, 29% do not, in part due to not knowing where these services are and how to get to them. When it comes to transportation, the U.S. Department of Transportation states that access to public transportation in rural areas is limited by travel times and distances, frequency of service, cost, and limitations in funding. This map on screen right now shows the lack of mental health professionals in America. The green shows the non-metro area and the blue shows the metro area. The darker each color is the greater the shortage is in that area. I'll now be passing it on to my colleague Sydney.
Thank you, Daniel. As we all know, 2020 was an unforgettable year for many. During this time, many communities had to undergo money and food insecurity. From closed businesses to a transition to an online world, many communities faced a tremendous amount of stress and grief, especially minority populations such as African Americans and Latinos. In addition to the pandemic, the world was going through traumatic societal and political changes such as the Black Lives Matter and the Stop Asian Hate movement. These factors had a significant impact on mental health in minority communities and highlighted the many health disparities these communities face. This graph illustrates the many economic hardships that the communities had to face. As you can see, Latino and Black communities had a significantly higher rate when it came to being unable to pay for basic necessities like food, heat, or rent, using up all or most of their savings, or having to borrow money or take out a loan in comparison to their white counterparts. Next, please. This graph illustrates the economic consequences of COVID-19 as it pertains to various communities. When it came to loss of job or income, not enough food, or housing instability, Black and Hispanic or Latino communities had a significantly higher rate. On the other hand, getting needed healthcare services, white communities had a higher rate. Next, please. This graph was a study done by the CDC. In the highlighted box, which was November 2020, around phase 3 of the lockdown, it illustrates that 52.6% of non-Hispanics, 48.2% of Hispanics or Latinos, and 43.6% of Black individuals experienced symptoms of anxiety or depression during the pandemic. All these health disparities were evident during the pandemic. However, as we progress as a society, there may be a potential solution that could decrease or eliminate the many challenges minorities face when it comes to accessing care. I will now pass it on to my colleague Mania to begin our solution.
Technological and medical innovation, an interdisciplinary solution. Next, please. Problem collaboratively. We utilize our diverse majors to solve the issue. Our innovation is rooted in both technology and medicine. Next, please. These community mental health units will be driven around both minority and rural communities. These units will be partnered with nearby safety net hospitals and will receive federal funding.
The mental health unit solves the socioeconomic, geographical accessibility to care problem among minority and rural communities.
This mental health unit will also serve as an interactive and educational resource for children and adults. It will also provide prescription pharmaceuticals to the locals in the community while providing nourishing fruits and vegetables.
In addition to these mental health units, we are also offering a kiosk. Next, please. These kiosks will be placed in rural communities, and they will display a map of the area and all of the mental health facilities in the area. This on the right is a map of Kansas and all of the rural healthcare facilities in it. This is an example of what you would see on this kiosk. Next, please. Here's a breakdown of how we've incorporated our majors into this solution. On the pharmacy and biochemistry side, this kiosk displays the location of any pharmacy and facility that can distribute drugs that treat the patient individually. The kiosk itself is the computer science side of this solution. And for the psychology and mental health concentration side, this device will display all mental health services in the area. Next, please.
We hope from this presentation you learned about the socioeconomic and geographical factors and how it impacts the mental health of minorities, how access to healthcare is imperative to eliminating health disparities, and how we would approach the problem to solve it. This concludes our interdisciplinary solution-based approach for mental health and health disparities.